we are going to have a time for the participants to ask questions. Anyone that is interested in giving an observation, please raise your hand or indicate on the comment box. But I've got a couple of questions. The first will be to Mrs. Oyegu. And that is, I think the first one was from
Dr. Nabulele.
No, it was from, I think, from Joy Ojakovo. What are the opportunities for women on the average? How long can you work in the organization? And how do you manage inter-country? Mrs. Oyegu, please, if you can unmute.
There are no restrictions on women's work in the multilateral sector. In fact, it's full of women, and perhaps the comment about broken relationships has to do with women. It's very difficult to move lock, stock, and barrel if you're going from country to country. So that sometimes poses problems for women. Most agencies now have or have introduced, and I would imagine, I actually got into the UNHCR as the gender advisor, senior advisor on gender equality. And this had to do with internal gender equality and operational gender equality. And so that's how I got into the UN system originally. And then I became diversity chief at the World Bank. So there are programs for women. I mean, we have a lot of work-life balance programs to try and make women's lives and careers, hold them in better balance. Because of course, women are still the primary caregivers in their homes. And so there are opportunities. Women do very well, sometimes at high personal cost, but they do well. I mean, the group I was talking to, I think it was yesterday or the day before, I noticed that it was 50-50, and these are, the middle management and upwards in one of the agencies, 50-50, female and male. But, I didn't take a marriage poll, but I'm prepared to hazard that a good 50% of those women were either not in relationships or were in difficult relationships simply because of the exigencies of the job. So these are things you have to take into consideration. If you have, if you're in a partnership and your spouse is prepared to either have a long distance relationship or to move with you, then, God bless you. If you don't, then that's something you have to take into consideration. I think that is more difficult for women than it is for men. Otherwise, there are no restrictions. And in fact, there are a lot of supports, as I said, to enable women to do well in their careers in spite of their, at least, child rearing and childbearing and child rearing responsibilities. Yeah.
Thank you. And another question, Dr. Enabulele, the president of the Commonwealth Medical Association, what he's saying is that from your experience, Mrs. Oyegu, tell us about the level of racial segregation, if any, in such bodies.
No racial segregation. I think what you're dealing with in most organizations, multilateral and otherwise, is what we call systemic racism. That is a situation where there are invisible and unconscious barriers that people of color experience as they either attempt to enter the organization or they strive to thrive in the organization. And so what you do is you check out the data, the historical data. You try and figure out, for example, if people come in and all things being equal, their credentials are the same, they're doing, very similar work, et cetera, why does the trajectory at maybe the 5 or 7 year point become divergent? Why do non-blacks do better than blacks, et cetera, et cetera? So there's work going on looking at that, particularly as a result of the Black Lives Matter. And that has triggered a lot of inquiry within these organizations. And, the little I'm seeing of it from my corner of the globe, doing consulting, I think they're trying to address whatever barriers might remain. A lot of these barriers are unconscious. People don't think about them. But if you're a member of staff and you've been in the organization for a while, generally speaking, you can tell where you know, sometimes it's a manager who's not very sensitive to cultural issues, who's not used to, you know, managing women or black people or disabled people, et cetera, et cetera. I mean, there are definitely impediments. Most of them are invisible, and you have to do quite a bit of research and develop metrics that will help you track progress, help you, and you know, try and help you to acknowledge. What I like about one organization that I'm working with currently is that they didn't ask, do we have problems? They went straight into, okay, how do we solve our problems? And I thought that was really good. You know what they say about Alcoholics Anonymous. The first thing you say is, I'm an alcoholic, and then you embark on the 12-step program. So yeah, I mean, these organizations have not been as accessible to people of color as to other people. They're also difficult for women. I don't believe it's conscious. I think it's unconscious. Systemic racism is difficult to uncover, but once you surface it, generally speaking, you can deal with it. If you have a leadership that's prepared to lead the organization out of those difficulties.
Okay, thank you. Question for Linda from Mrs. Ojakovo. How can you create opportunities to get speaking engagements? Linda, I think from your learning sessions. Linda, if you can unmute.
Hi. Yes, so speaking engagement. So when I was speaking about sharing knowledge as a way of learning, I was speaking about attending professional conferences. So, excuse me, these were either national or international conferences that were held for behavioral economics experts. So it was literally, if I'm honest, us being invited to participate and us taking the opportunity, as opposed to us seeking out the opportunity to attend these things. But I suppose professionals amongst us will be part of various networks that hold conferences. So if one was looking for speaking opportunities, that would be my first place to look, what the networks are doing and whether they were putting on events and whether one could put oneself forward. But when I was talking, I was speaking specifically about technical professional conferences that we were invited to.
Okay,
hopefully that helps.
Thank you, Linda. Another, Niyi, would you want to say something here?
Yes, I think listening to, I missed the first speaker, so I could only comment on the last two speakers. But essentially, I think what Linda was explaining, I think it does resonate with me when I think from a corporate point of view. And the idea to, so I think she used a term called learning on the job or learning by doing. So that term is actually quite familiar. It's a familiar one which Hewlett-Packard historically promoted with his employees because you learn throughout your working life. And so learning by doing, where you're really actually allowed to make mistakes to develop is actively encouraged. So that I found actually quite good as a takeaway from Linda's presentation. And if I may just comment also on I think it was the Scottish guy. I'll call him Scottish. I know it's not Scottish, but anyhow, I call him Scottish.
Don't worry, I'm Scottish and Nigerian.
Yeah. So Mark, yeah, I mean, essentially the countries are also that you use. Singapore, for example, that you use is also a country where I do extensive business. And interestingly, I know Nigerians typically talk about the former leader. When you talk to Singaporeans, and this is not a critique, by the way, when you talk to Singaporeans, they demand more out of Lee Kuan, because as you probably know, his son also took over. And when Singaporeans talk about what he gave to the country, so his father, the Singaporeans keep telling you that, yes, he should have done more, he should have done more. And what I really do like about Singapore, which I think for us as Nigerians generally to take back home, is that we need to promote the youth to be part of the solution of a lot of the issues we have in Nigeria. Because if you look at Singapore today, a lot of the developments that are going on in Singapore, you find out that you have an age group of between 15 to 20-year-olds contributing effectively to policy making in Singapore. So, and Nigeria, luckily enough, we also have a massive pool of youths, which we could take advantage of this creative, I would call it a gene within this youth pool of people that we can take advantage of, and hopefully also provide them with guidance. And lastly, on the lady who spoke about experiences from international organizations, what can I say? I mean, without the international organizations, I guess Nigeria or us as a race of people, actually, I would say the sub-Saharan Africans, we may not even have a voice. So yeah, so it's actually been quite good listening to everyone and learning. So those would be my observations. Thanks a lot, Alero.
Oh, okay.
Thank you so much.
Yeah,
I can
Dr. Mark.
Yeah. You know, it's interesting when you talk about the Singapore experience and, you know, that healthy tension. I've been in a number of places and where you have some very high level meetings. What really instructs me is that you have the young as well. In fact, one of those sessions we were in Singapore, there was this, some colleagues from America, they were like amazed because they said in America, you don't find the young people in the room. But here we are in the room, you have very, very at the highest level of people. And then you have, at the same time, you have some of their sons who are 18, 16, you know, children in the room, not children, but youths, all in the same room, discussing the same subjects, making the same decisions. I mean, that was very, very, very unusual. I talked about the Israeli army. One of the things I saw amazing about the Israeli army, they're the only country in the world that does that. When they have a battle or when they do after action review, they are the only army in the world in which both the corporals, the privates sit in the same room with generals. And they will speak to the generals and they review the two together. You know, other countries, they will, you know, keep the senior officers, they'll do their review. The officers, lower levels will do their review. And then, of course, nobody even asks the privates and the sergeants. But in the Israeli military, the only one that does in the world, everybody sits on the same table. And the private can challenge the general, you took the wrong decision. You can know that that is so amazing. And because of that, obviously, I mean, they are probably the most effective military force in the world, you know, for their size and everything else, you know. So yes, we just, by having them come along is also part of the mentoring, developing capacity, because by doing that, you are bringing capacity of those young ones early, so they can step up very quickly. One of the reasons Israel does that, because of their small population and everything else, they have everyone have to be able to take on, to respond, to fight, and all of that. So I completely agree with you that we shouldn't see the youths as nuisance, but actually is to utilize their energy and put them to good use. Thank you.
Thank you. Kede, you said you were going to make an observation.
Yeah, a couple of things have come up. Can you hear me?
Yes.
Yeah, a couple of issues. I'm looking at the chart, and I have to start with Mrs. Oyegun being somebody who's done it at the highest level, the World Bank, UN, and so forth. How can one of the issues, let me take this back, and people actually get upset when I say it, but I'm going to say it anyway, is that the biggest challenge that I have with our people, not necessarily age barrier, I think it's a mindset that requires, I don't want to say it's a mindset affliction, that will be going a little bit far, but the mindset challenge of us as people in Nigeria is very, very pertinent that is looked into. And when I say mindset challenge, in the sense that from empirical evidence, things have gone wrong. We cannot pretend things are okay. So I don't know who will be able to look at that in a way that is it through education, is going to take time, how long is this going to take? But if you don't really deal with that mindset challenge, I'm afraid every other thing will be in place may not necessarily gel. Well, some people disagree with me on that, but that's how I look at it. And then coming to Mark, the question I want to put to you is, how can some of studies and everything you've done be put as a system for us as a people to understand? Because one of the things we're doing in this series, and we've done 10 years, is to translate it to the Nigerian, because sometimes it says my bandwidth is low. Hello?
Yeah, we can hear you now.
Okay, so the point I was making, let me just quickly recap, is that with back to Mark, is that how can the young Nigerian benefit from a system that described very well, like the Israeli one? I don't think that's going to work in Nigeria because it's more of a feudal system. So everybody wants to be and nobody really wants to listen. Again, that would be education. And then coming to Linda, you actually talked, I think I like that very much because, like I said, I don't know whether Cameron got that from Obama, but Obama was very clear in using, and that was how he was able to drive his policies, nudging people to understand. So if you're going to have behavioral units, I think Nigeria requires that as a way of addressing the mindset challenge. Nobody has to start this, and we've had this discussion. We've talked about mindset challenge, so we need champions to join us to be able to solve that. Those are my just few observations.
So Kede is saying mindset challenge champions, although it was breaking. So question for Dr. Mark and then Linda. Dr. Mark, please.
Yeah, thank you so much, Kelly, on what we do. So what we have done for a number of years now, but now we're taking it further, is we've created a three-pronged program for youths in Africa, not just Nigeria, because it's the same. Like we said, the problem Nigeria is facing is similar to the African nations. We are all in the same boat together, so to speak. So a three-pronged program. One is to train them in a structured training program, in which everyone that comes in goes through a 3-year program. And then the second leg of this whole program is what they call it, experience, in which we have mentors, who mentor them at the same. And then the third leg is that they are also then expected as part of that program to begin to do things right now. One of the things that we do know is that if you have done things before, you can do it again. If you've never done something before, then it's almost unlikely that you're going to do it before, because there's no pattern, there is no template to draw from. So, and therefore, everyone that is in that program is expected to deliver results, deliver projects at whatever level, that is their local level, their village level, community level, their neighborhood level. So those are the three programs that we are working on right now. So we've been doing that quietly over the last couple of years. And last year we had a launch in Abuja, actually, and also in Nairobi. But in December, then we want to go full hog. So yes, that's what we're doing. So I'll provide more information to you so that, yes, if there are ways we can collaborate together, that would be great.
Okay, thank you. I know, before Linda, you speak, I know Mrs. Oyegu is also involved in a youth empowerment program. in Edo State. Linda, after you've spoken, Mrs. Oyegu can share that with us. Linda, please unmute.
Hi, John. Would you be kind enough to repeat the question, because the audio is poor, going in and out.
Hede.
Okay.
Your question to Linda.
You hear me now?
Yes, I can hear you.
Okay, I was just saying that, you know, on the behavioral unit thing, that Obama had used it very effectively in the White House. So I don't know, maybe Cameron got it there. But the thing is, how can you add that to the youth challenge in Nigeria as policy, using and behavioral combined? How can that be applicable to as a policy to population in Africa or Nigeria?
Well, it certainly has plenty of application. For starters, is where I'll start in response to that. I think there is a role for all actors in this, not just government. What we see here, certainly in the UK, and as you referenced the US, is that behavioral approaches are taken across every sector, from private to public. And especially in the voluntary sector, they're probably the biggest users of it as a theory in use. So I think that there is plenty of scope for, on an individual level, to read. We've been talking a lot about having a learning culture and recognizing the benefits of continuous learning. The literature on behavioral economics or behavioral insights, however you describe it, is actually very accessible. It just brings together insights from two disciplines, psychology and economics, and makes it a much more reliable science, if you like, than either of them individually. So why I was referencing that is the fact that we as individuals have a real opportunity to upskill ourselves by just understanding the behavioral approach to change and using that in our own lives. We can also be champions of the approach for our organizations wherever we work, even as we get a greater understanding of how it can contribute. And we can share that, either to say that we can lead the introduction of it to the organization, or we can connect the organization with experts in the field. And then obviously for those of us who are in government, there's a real opportunity to effect change at that level also, by recognizing that this is not just the innovative way to bring about change at citizen level, but it's actually very, very cost effective. So there's a business case for adopting it as an approach.
Okay.
I hope that's helpful. I'm just going back on mute now.
Very, very helpful. I'm going to, Mrs. Oyegu is going to speak in a minute, but before she speaks, what I would do is to also call, after Mrs. Oyegu, to also call Tommy Fashina and also Dr. Sahoe Nabulele. Mrs. Oyegu, you first, please.
I belong to a group of people who are very keen to see local governments become a real tier of government. It's the third tier under our constitution. You rarely hear anything progressive about any of our local governments.
Will that change the dynamic for Nigeria? When the local government...
It ought to. I mean, you're talking there about grassroots governance, bringing governance as close as possible to the citizen. So if it doesn't make a difference, then I don't know what will. I mean, if we're going to retain this three-tier structure of government, then we must expect more from local government. And so I'm working with a group that's...
So from a capacity building perspective, how would you...
I mean, the big story there is who works in local government? What are their key performance indicators? What are their results agreements? How are they evaluated? I mean, what is the performance architecture for local governments and local government officials? Chairpersons and councillors in local government, who are they? What do they do? You know, the Commissioner for Local Government and Community Affairs, you know, does he have a strategy? Does she have a strategy? So it's getting into the nitty-gritty of local government, at least in Edo State, to find out whether it, in fact, to expect better delivery at the local government level. A lot of states are doing things that local governments should be doing. And that's a sign of systemic failure. That's a systems failure. And so to get into that, I think, is very important to the quality of citizenship in Nigeria.
Right. Are you involved in anything to do with the governance?
You mean directly? Am I a politician? No.
No. What I meant was governance of the local government structure.
No, I'm not. I don't work in local government.
All right. But in terms of capacity building, you said there's systemic failure out there. So what you are saying now is that structurally, across the board, there needs to be fixes in the system.
Well, if we're talking about civil service reform at the state level, then we should be looking at something similar at the local government level. Local government is not delivering. It's not delivering.
Right. Okay. All right.
Try and figure out why, what the hindrances are, what the problems are. To try and figure out what those problems are, to get enough data to try and figure out exactly what's happening on ground from local government to local government, I think is key to recommending solutions to the problem. Local government is not delivering to the citizen. It's not.
Linda, before Tommy and Dr. Saho, Linda, from a Department of Work and Pensions perspective, does the UK government have effective local government structure in terms of capacity building? Linda.
That is not a question that would be appropriate for me to answer.
No, answer from Mrs. Oyegun's one. She said they are not delivering. Would you be saying the same thing?
It's such a no. It really isn't an appropriate question to answer. So if it's okay, I'll decline to make a response.
Okay, that's fine. Tommy, please unmute. Yeah.
Okay. Good afternoon, everybody. And I must say it is a great pleasure to be able to attend, participate, and benefit from all the great things that have been said so far. I appreciate everybody who has spoken. My simple question is this, and I've been asking this question for quite some time. I am in this age bracket that is far as in like on the lower side, and I'm really hopeful that I see before I die this dream that we have of a better Nigeria. My question is basically wondering how we think that we can harness in the shortest possible time all the great experiences that our Nigerian citizens have garnered all over the world in the different countries that we have gone to, America, the Australia, those that have gone to the Asias, seeing what the Asian tigers have been able to do, and how we can harness all that for our collective national growth in the shortest possible time. That is my own basic question. If anybody could, buttress or give insights into what they feel is going to be the best approach for us to achieve the best in shortest possible time.
Well, if I
The
may,
panelists, Dr.
I may offer a thought on that. Is a very interesting question you have asked in relation to when are you going to see the vision of the promise of Nigeria fulfilled. That's a prayer. And
I want it now. Yes, we are all desirous. So the system is broken.
Yeah.
It's totally broken.
So in terms of Nigeria has lots of people. In fact, Nigeria, as you know already, we're one of the most blessed humans in the world. I mean, amazing, doing both in Nigeria and outside of Nigeria. I saw the comment by Dr. Enabule on talking about the useful age. Indeed, so we are so blessed. So it's not as if we don't have enough people in Nigeria. We have enough people in Nigeria to make turnaround. It's just the system that needs a little bit of tweaking here and there. That's like we said. Really the 60 years now is a good enough time for the country to be renovated. And I'm not revolution or restructuring per se, but not those things, but rather to go innovation, develop new systems. And with those things already, it's just create an environment for everyone to flourish. that's really what we need, an environment for everyone to flourish, you know, and that's all we can, that's what we can pray for, and then do our own little bit wherever we are, and to help that process. I remember someone told me a long time ago, he was an expatriate in Nigeria doing very well. He said, he was talking about India, that India really turned around or began to turn around when there was a huge, you know, the country became attractive enough for a lot of the you know, experienced and well-educated not well-educated, all educated well anyway, most of them, but those who had global experience to go back. It's true, because I remember when we were in secondary school, my secondary school was in Nigeria and in Benin. And I know that we had so many Indians teaching at the time, you know, but you know, at the time, but many of them went back home. So I think when there's that, you know, that atmosphere in which those in Nigeria flourish and those who are outside can flourish as well, then I think that will be part of the renaissance, if you want to put it that way, of Nigeria.
Okay, thank you. Dr. Enabulele,
Yeah.
do you want to say something?
Okay.
Please unmute. And then Johnny, Dr. Enabulele here.
Yeah, thank you very much. I really wanted to observe and watch. I honestly believe that a lot has been said by the speakers. I commend all the speakers. I commend the organizers. Importantly, I think Mrs. Oyegun's presentation was very phenomenal. And I think that I want to advise that perhaps the presentation is properly packaged for dissemination.
Yes.
Because a lot more people need to listen to these presentations. So my first advice would be that perhaps we do something about publicity for these seminars, so that many more people across, you know, the various divides get the opportunity of listening to these inspiring talks. So I want to say that it's been very exhilarating, very interesting, very enlightening. And I only just want to say that the challenge of Nigeria is really complex. For those of us who have tried to remain here, with the belief that things will get better, you know, every year, I want to tell you that it's not that simple. The complexity is evident, and you have to come back to understand how to deconstruct these complexities. Yeah. I think for me, primarily, I see the challenge not as a way, with due respect to my brother, Dr. Gehan put it, that of small people in government, or that of not incorporating the youth. I was a youth when I contested for governorship in Edo State in 2007. The time Oshomole was also picking his form to contest. And I can tell you the experiences I faced, you know, so, and from where the challenges came from. So the problem I see is that about what I call a poor ethical orientation about public service and governance. You know, there's been this poor orientation that everybody, particularly because of the historical issues, people now see it as more like there's been this culture, this elitist, you know, regional and, if you like, class mentality, you know, that has bolstered this entitlement mentality in our country. So everybody comes to service with the aim of grabbing. And you see the evidence of corruption everywhere. So nobody is talking about how to, you know, create, you know, public goods for the greater majority of Nigerians, but how to benefit himself, his generations yet unborn, and the rule of law is absent. Nobody is brought to account. And so even if you have the best of hands come into positions, you find out that this culture mentality encircles them. And unfortunately, a lot of them have been unable to extricate themselves from these labyrinths. And so it becomes a vicious circle. And I put a question to Dr. Egeon on the chat that it was not really a question, it was a comment. I mean, if you look, I don't believe it's about a young man in office or an old man in office. It's just this issue of mindset and mentality. We've had a lot of young guys in various privileged positions in Nigeria as governors, as ministers, and you begin to wonder what has happened to them. The whole culture change, governance reforms, you know, and even orientations at family levels. A total reform of the whole system, not just about who comes to office. I mean, it needs to be undertaken. And of course, you know, this also has bearing on our electoral system, where the best hands really do not get thrown up or even get elected because of the whole electoral deficits. So there's a lot to, you know, tinker with Nigeria, but it will take a lot more to deconstruct these issues and pray that people who really are conscientious and well-meaning and committed can tolerate first the shenanigans in the system and persevere to gather to form a critical mass of same minds to redirect the whole system. And you can only do that if you have the opportunity of coming to top leadership positions, all right? Because you need to be there to change the system. So these are critical questions that need to be, you know, answered before you can begin to talk about reforms. I was a member of the National Conference in 2014 that was set up by President Ebele Jonathan. We had a lot of reform issues that were discussed, a lot of very profound decisions taken at the plenary sessions of the National Conference. The question Nigerians should ask is, what has happened to those resolutions? So we come, give beautiful presentations, beautiful resolutions, but the question we should ask is that why are these things left in the shelves and not given that level of implementation that will turn Nigeria around? We have a lot of brilliant minds all over the world, but I dare say that we all need to come to change Nigeria and be committed to the change process and banish this mentality, this crass corruption, this elitist and class mentality that has pauperized the vast majority of Nigerians who now, of course, resort to very extreme ends to, of course, attend to their own survivalist tendencies. So that's the much I want to say now. I have enjoyed this session, but I honestly wish that we can have a lot more Nigerians participate in these very enlightening sessions. You're doing very well, you're doing an amazing job, and I pray God to continue to strengthen all of you. Thank you.
Thank you. Thank you, Dr. Nabulele. I'm very conscious of the time, but what we are going to do now, I will give a minute to Johnny to make his observation, and then the panelists a minute each to close your presentations. And I will then call on Kede to give his closing remark. Johnny, if you can unmute, please.
Yeah, oh, thank you. Thank you. I think will a minute be enough, but
try.
I think this gentleman has touched most of what I wanted to share. I really wanted to share stuff with Tomi, because we have these discussions even among the professionals working in the government, because I consult with the government in Canada. And sometimes we have these discussions among us Nigerians, say, what is the way forward? What do we do first? Then how do we ensure that, you know, what we are doing here, we can also take it back home? You know, so, but one thing you should know is, I just say, is a mindset, okay? And we should always talk about system thinking. System thinking, when you tell people about that system thinking, they don't understand where you're actually driving to. We all live in a house today. You have a house. That house, if you just, the way the building, everything is, if you want to think of it as a daycare, the way you move things around, believe me, that structure, everything will remain, but it will not be a daycare. If you want to turn it to an hospital, that building will remain, but there's a way you structure inside, it will turn to an hospital. The same thing with Nigeria. So, and when we begin to see that the system, then we begin to, you know, talk how we go into, you know, make sure that everything is functioning well inside the system. So that's where the first thing I can tell you now, to me, is really restructuring, because this federal system and this centralized system that we are is not going to help us. Okay, but if we are able to decentralize, we are able to restructure, and we go back to our constitution, because that constitution, just like in Western world, they have systemic racism. Okay, the people that assisted us even in documenting our constitution, okay, they were doing it, the people they were helping was not seeing what they were hiding in our constitution. There are so many hidden stuff in the Nigeria constitution, believe it or not. But I don't want to take most of our time, but we'll get there. But we have to go back to our constitution. And finally, we just hope for the better. Because the Nigerian today, I can tell you, everybody, even if you're in Canada for the first time, the first thing that comes out of your mind is God bless Canada, for no reason. So it's just coming out of you. Why? Because of the way the system has been programmed to help every individual. But today, if you are thinking as a Nigerian, what comes to your mind? Corruption, insecurity, okay? And the corruption and insecurity should come to your mind. Why? Because the Nigerian government did not even make provision for security. I have a father that I'm sorry that I'm just making a quick example. I know he has worked in almost all the tiers of government. But believe me, when he was sick, okay, we have to fly him to London for treatment. The first treatment for hospital bed, they say 45,000 pounds just to admit him. And we started selling stuff just to take care of him. But this is somebody that has served the government. So when there is no security, what do you think people in government public positions should do? They want to try and gather stuff so that they can build security for their, whatever time be, for the unseen. Because the government did not make provisions. So I don't want to dive into all that, but we'll share more ideas next time. Thank you.
We'll come back to this. Thank you very much.
Thank you, yes.
What I would do is to ask...
Thank you to all the speakers too. So that was very insightful, and very thoughtful.
Yeah, because we have regular series. So please let us know the kind of topics you want us to look at. We've got a lot from today as well. Mrs. Oyego, if you can please conclude where you started from your own point. Yeah.
What point would that be? What would you like?
I think what you would need to do, from your experience as a diversity expert, and based on COVID-19, Black Lives Matter, what is happening in the country, what would be the takeaway for people to, your closing remark?
Well, I think we have a lot to thank God for. I mean, we haven't suffered the casualties that many countries have suffered from this pandemic. We're very, very fortunate. Nobody can explain how it is that Africa has gotten away so lightly. But God is clearly merciful, because it's definitely not it's definitely the situation would have been that our healthcare services would not have had a hope in hell of protecting the public. So we are very, very grateful to God that we've managed somehow, by some blessing, by some divine intervention, we've managed to avoid definitely the worst of the pestilence. So, but it's a wake-up call, though. I mean, if we are going to have to learn how to live with COVID, then we are.
We can't hear you. You sound
breaking.
I'm not sure why. I'm not sure why.
We can hear you now.
Okay. So, but it's a wake-up call. It's clear that we will have to step up the quality of our healthcare services. You never can tell when the next pandemic will come along, and we may not be this lucky that time. So, thank you, everyone. It's been a pleasure.
Thank you. Thank you. Linda.
Thank you, John. It will be quick. I'm always quite brief. Firstly, to say thank you to panelists, to the participants. It's been a really lively discussion that I've learned a lot from, and I hope you have too. I wanted to leave you with what I always say to audiences when I'm part of these kinds of conversation, which is that the change must start from the individual. And when we attend these sorts of things and we have very useful conversations and we talk about change, it's so important to think about ourselves first. So whatever it is that you have listened to and heard, that, whether it's a behavior, whether it's an attitude, whether it's anything that you think I wasn't doing before and it makes sense to start doing now, please do start doing it, because it will make a change. It will make a difference if each of us takes that personal responsibility. I wish you all the best.
Thank you, Linda. Dr. Mark.
Well, let me say thank you so much for inviting me to speak tonight. It's always an opportunity, it's a privilege to be given an audience to share with. I want to say, in relation to what Dr. Enabule said, and I do agree with him, the issue is not the youths, because a lot of youth in Nigeria is also not, I wasn't suggesting for any minute that the people in power are small people, no way. I mean, every Nigerian most Nigerians are greatly smart in every way. So I think that's all I agree. Part of it is the fact that Nigeria hasn't metamorphosized, beyond what the British left. So we haven't designed any new system. So it's like creaking, just like everything else. 60 years, everything is creaking. So it just needs a renovation, just to put things up. Now, in terms of the fact that, yeah, you're very right. I think Linda said that in all places where we find Nigerians, we're spending a lot of time, like we're talking about the issues. But I think one thing that is empowering is if every one of us can do whatever little we can do in our own space, that will help a great deal. It may not change everything entirely, but at least it's just empowering to know that at least in my own little space, I'm doing something, no matter how little. And collectively, then that can become something. And as Mrs. Oyegun said as well too, God has blessed us. In Africa, we're really blessed in every way. If you talk about resources, a large part of all of the world resources, minerals, and the others are all in Africa. Congo, DRC on paper should be the richest country in the world because a huge proportion of the whole minerals in the whole world are in that one country. So all we now need is just to do our own little bit, and then God will do his own bit of coming in to do what we cannot do. So thank you so much for the opportunity, and I'm very confident about the future of Nigeria.
Thank you very much. Thank you, everyone. Mrs. Oyegun has said that it's a wake-up call, and we thank God, and also that the quality of our healthcare needs a lot to be desired. Linda has said charity begins from us, that we should think about ourselves first in our capacity building. And Dr. Mark has said, yes, the system is creaking. Because Nigeria needs to be redesigned or reconstructed, but we should be doing the little in our own space. So starting with ourselves. I think when we're able to do things from ourselves, we'll be able to make an impact on a wider scale. I'm going to call on Kede to give his closing remark. Kede.
Yeah, thank you very much, everyone. It's been a very wonderful 2 hours productively used. So let me again thank Dr. Mark, Linda, and Mrs. Oyegun for taking time out to come and discuss and share with us their vast experience. And I'm sure everyone enjoyed it. Some of the comments that have been put in the box is taken into consideration. I think for us, we're going to share the recording. Sometimes we do get calls from, I would say, governments in emerging markets wanting to speak to us. So again, thank you very much. Our next one really is going to also be very interesting, which will be, I believe, 6th of December. It will be
4th of December.
4th of December, I stand corrected, on digital economy, I think. So that will be very interesting. But on the comment that it should be widely circulated, we will do that and promote it and ensure that there's a lot of participation. But the most important thing for us is the knowledge that is displayed here today. And so once again, thank you, and God bless you all. Have a very wonderful weekend. Bye.
Thank you, everyone. Thank you, and see you in December. Have a great one. Bye all.